Good afternoon, Aisha. I just sent you the link, the live stream link.
Hello and good day, everyone. Uh, I welcome you all, Afro Medics, and thank you for joining us for today's year plan presentation. Today, our team members, the FAMSA Executive Council 2025, has arranged a document of a master plan for you, and I hope you are ready to listen and receive the interesting works we have ahead. Thank you very much. Let's give a few minutes additional time for other people to join us. Thank you. Okay, good day once again, everyone. Hello, Afro-Medic. You're very much welcome to the FAMSA 2025 year work plan presentation. And I'm Aisha Abubakar. I'm the FAMSA General Secretary, and I would be moderating today's session together with my Assistant General Secretary, Martha. So thank you, and I hope it would be an amazing session ahead. So without wasting much of our time, I would like to invite the FAMSA President Muhammad Isa Jafar to give us a welcoming remark. Thank you, Muhammad. Mr. President, the floor is yours.
All right, thank you so very much, Aisha. Please let me know if I'm audible.
Yes, you're very much audible.
All right, thank you so very much. So, good afternoon, good evening, dearest African medical students, our partners, and the entire FAMSA community. Thank you so very much for finding time out of your very busy schedule to join us in this very important session. Today we will be sharing with you the work plan that we have for this year, and we believe it's going to be a kind of an insight on what you should be expecting from us this year as we navigate through this tenure. So please join us in this session and pay attention, ask questions, engage very well because this is here for you. Thank you so very much once again, and we look forward to a very successful session. Thank you. Back to you, Aisha.
Okay, thank you very much, Mohammed, for the warm welcome. So moving forward, th this would be our agenda for today. We have a welcome address by the moderators, which the president has already given that. Then opening remark by our ex officio one, which is Dr. Cinnamon, the immediate past FAMSA president. Then overview of FAMSA and focus areas by 2025 FAMSA president. Work plan presentation by all EC members, questions and answers. Closing remark by ex officio 2, and then pictures. The moderators were supposed to be the headquarters administrator, Dumeji Olawi, who is unfortunately unavailable, is on transit, and I would be moderating on his behalf, and then the Assistant General Secretary, Martha. Thank you everyone for joining. So having the welcome address already given, I would move forward to the opening remark by ex officio 1, Dr. Cinnamon, if he is with us.
Good evening, everyone. Good evening, Aisha. I'm sorry to interject as the ex-official member one is unavailable. I think she's on transit to Rwanda to attend a conference. So on her behalf, I'll give welcoming remarks, of course, to the EC, the MSAs represented here, different countries, and also the different partners. I want to welcome you officially to the 2025 year work plan presentation. There is much that has been laid on paper and cannot be presented on this PDF, but this is just a highlight of what we are looking. It's just a footprint or a blueprint of what we are going to present to African medical students in the whole continent. So in our vision, in our motto, I want to welcome everyone on board. Kindly pay attention to any detail, ask anything, any clarification, and I want to thank all the EC members who took part in development of this plan. There will never be a perfect work plan, but I'm sure that this is a capable EC to deliver whatever they have presented or they have prepared for you. Thank you so much.
Thank you very, very much, Bonaventure, our Vice President. Thank you very much for giving us the opening remarks in place of the ex officio one. Thank you. So moving forward, we have an overview of FAMSA and focus areas of 2025 by the FAMSA President. Mr. President Mohammed, please, you have the floor.
All right, thank you so very much, Aisha, for having me again. Please, can you move the slide forward? All right, thank you so very much. So very briefly, I'm going to be sharing with you a little bit about FAMSA, and then just give you an idea of what our focus area this year in FAMSA. So the FAMSA stands for the Federation of African Medical Students Associations, which is an independent non-political federation of medical student associations that is membered by medical student associations that is membered by over 200 medical student associations all across Africa. It was founded in 1968 as a Nigerian, Ugandan, and Ghanaian initiative to foster the spirit of friendship and collaboration amongst African medical students to be able to champion advocacy and co-implement programs that would improve the healthcare system in Africa. FAMSA is a project-oriented medical students body, and it is structured as follows. It has its permanent headquarters in University of Ibadan, which is headed by the headquarters administrator, and then there is the executive council who are elected at every general assembly every year. And this executive council consists of the president, the vice president, the general secretary, general treasurer, and then all the chairpersons to all the standing committees. We have 5 standing committees in FAMSA: the Standing Committee on Health and Environment, the Standing Committee on Professional Exchange, the Standing Committee on Population Affairs, the Standing Committee on Medical Education and Research, and then the Standing Committee on Publications. So aside from the chairpersons and their standing committees, there's also the coordinators of each sub-region of each regional council in FAMSA. So as part of the structure of FAMSA, the EC is also membered by the coordinators of each regional coordinator. There is one regional coordinator for each of the sub-regions of Africa. There's a regional coordinator from the regional from South Africa, North Africa, West and East Africa, and Central Africa. So these are the people that constitute the FAMSA Executive Council. So aside from the Executive Council, the regional coordinators, the chairpersons, and the standing committees, there's also technical working groups. So depending on need, FAMSA do have technical working groups that help in implementation of programs that are essential that do not necessarily fit specifically in either of in any of the standing committees that exist, or perhaps there is need for priority on that topic. So an establishment of a technical working group. So I believe later on the vice president is going to be giving us some highlights on the technical working group that we have so far and what they are going to be working on this year. So that's a little bit of an overview of FAMSA. If you want to know more about FAMSA, you can kindly check the FAMSA's website, which I'm typing right now at the chat box, or you can reach out to us, to any of us later. So yeah, that's a little bit of an overview of FAMSA. So to give you an insight of what our focus areas are this year, we are intending this year to strengthen FAMSA's institutional framework. We want to implement certain policies, and we've developed a three-year strategic plan, which we are trying to see how we are going to implement it to increase to enhance the efficiency and professionalism within the organization. And then we're also trying to expand the FAMSA's reach and impact, because as the growing need of medical professionals in the region is increasing, that's how the medical schools are being established and new medical student association are coming up. So we're trying to see how we're going to reach out to these medical schools and have FAMSA present in every corner of Africa, and then have them engaged in what we do. And then also trying to expand our impact through, consolidating on the projects that we've been doing that are very impactful, and then trying to see where else we can improve on. And then this year also trying to be heavy on advocacy and representation, because we believe FAMSA is becoming a global health stakeholder. The voice of the African youth needs to be heard not just within the walls of Africa. It also needs to be heard across borders globally. So this year we're trying to see how we can make ourselves available and present at global stage that's talking about healthcare. And then finally, we are trying to see how we can be more heavy on capacity building and youth engagement, because we believe there are more challenges that are coming up, that are coming into the healthcare system. And one of the first steps to addressing this is in building capacity. We have to understand them, we have to learn these skills, and we have to know the tools that we can be able to use to solve those challenges. So this is why we are trying to, we have it as one of our focus areas this year, to build capacity and to have youth meaningfully engaged on global health stage. So this is like an overview of the focus areas. So I believe later on we're going to be going into details of our projects, and you're going to see how these projects are reflecting to our focus areas. So yeah, if you have any question, please you can either drop it in the chat box. I can reply you there, or maybe you can during the question and answer session, you can ask. I'm going to be here to the end of this session. Thank you very much, and back to you, Aisha.
Thank you very much, Mr. President, for the wonderful overview of FAMSA and our focus areas for 2025. So we're going to move forward to the presentation proper, starting with standing committee chairperson. So EC members are going to come out and present to us what they have for us during the year under their respective offices. So I would like to call on Martha, my co-moderator, to continue from here.
Hello, am I audible?
Yes, you are.
Okay. Good afternoon, distinguished members of the EC, respected partners, and medical students across Africa. My name is Teresa Sindik. I am a student in the Higher Institute of Science and Technology of Mozambique, and I'm part of its MSA. This year, I'm serving as the chairperson for the Standing Committee on Professional Exchanges. I would like to have your minutes, your attention, since I'll be presenting our yearly plan. So our plan started in February, where we had our alumni meeting that intended to foster membership, knowledge sharing, and facilitate the handover of ongoing projects. We also had the introducing FAMSA Scopy in every region, where we had different events in those regions. In a segment of that event, we had an opportunity to share and present more about FAMSA Scopy. March for Scopy is the tuberculosis month, where we will be focusing on launching educational activities and awareness campaigns in all MSAs in different regions to contribute to the TB prevention and treatment. but also we will have our webinar on women's health. And we invite all medical students across Africa to join, since we will be discussing issues like maternal health, reproductive rights, and other important topics around women. April for Skopje, we start with the World Health Day, where we intend to celebrate it with awareness, health awareness on social media, and all medical students as well are invited for that. As we all know, as medical students, stress is something that we have to deal with it almost every day. That's why Skopje decided to organize a fun stress relieving day in all regions, and our regional coordinators will plan different types of relaxing activities that we all as medical students can be part of it. As tradition, we have our academic series, and this year we will host it in May, where medical students will have the opportunity to get more insights about key medical topics. And June, since we all know is the Children's Day, it's the Children's Month. So our activities as Skopje will be centered around children, whether it is going to orphanages, organizing other activities to celebrate and embrace African children. But also we intend to host a pediatric webinar where we will discuss different topics around children and their health. July, we intend to host a self-capacity building workshop series. All medical students are invited to be part of these activities. And these workshops will be focused on leadership, teamwork, and personal growth. In July also, we will have the Global Student Study Tour that's going to happen in Kenya, and it's being organized in collaboration with the FAMSA regional committee and also the Pwani University. We intend to provide medical students from all regions and all different parts of the world an opportunity to explore the different things that you can find in Kenya, get exposure to new healthcare system, and understand better how things work over there. In August, we all know that it's Youth Month, so we intend to empower youth, whether it is with financial literacy, workshop or other activities important like entrepreneurship in healthcare. We want to equip medical students with valuable insights on budgeting, managing. As a student, it can be a really difficult task. Planning or getting financial stable now and later, because we might not have the opportunity to understand money until it's too late, and it's going to be more difficult. So the earlier we understand it, how it works, even as students, the better for us. Also, we want to host a webinar focused on entrepreneurship in healthcare, highlighting successful healthcare startups. In September, we want to host a non-communicable diseases workshop or activity related to that, where we will focus on the different non-communicable diseases that we have, and of course we will focus on the ones that we have higher rates in Africa. And also we want to have our trip to Tanzania, an exchange trip, where we intend to provide students an opportunity also to explore and experience healthcare in a different sets, and understand the different culture that they have there, have the opportunity to connect, to make new friends with other medical students. In October, as if you know Skopje, you know that we have to do cultural exchange series every year, and this year is not going to be different. we will host a cultural exchange series between different regions within Africa. All medical students also are invited. And we have the AMSA Japan exchange series as well that's going to happen in October. And we will have also the Pink October campaign that we will either launch a campaign on social media, or we can even create webinars or even physical activities in our universities to celebrate that. So that's our yearly plan. I hope to have all medical students across Africa with us in this adventure, and I'll count on you to make these activities happen. Thank you.
Thank you. So that has been Teresa, Chair of COPI. Up next we have Michael Faride, Chair of COPA. The floor is yours. Michael, if you're in the call, please.
Moderator, please maybe make him co-host so that he can be able to unmute.
Okay.
Hello, everyone.
Hello, Michael, we can hear you.
Can you hear me?
Yes.
Okay, thank you. My name is Michael Shwede, a medical student from Kairuki University in Tanzania. So I'm from Tanzania Medical Student Association, TAMSA, and now I'm serving as the chairperson of the Standing Committee on Population Activities, SCOPA. So first of all, SCOPA, the key focus areas of SCOPA are child health and maternal health, sexual and reproductive health and rights, family planning, food systems, and population activities. And the action plan of activities are planned that the activities will comprise of online webinars, online campaigns, and physical events which will be performed in the medical schools across Africa, and we are under the MSA officers of SCOPA. So in February, we had cervical cancer awareness and HPV awareness campaign in which I participated in one of the medical schools in Tanzania. They had cervical awareness medical camp in collaboration with a cancer institute here in Tanzania called Ocean Road Cancer Institute. And also on International Day of Women and Girls in Science, I partnered with an organization specialized for girls in STEM called Unite Africa here in Tanzania. Had an event, and therefore because there are still a process of recruiting the members, forming the committee of SCOPA, including the secretaries and other officers. So now, for now, we are complete a team. So starting with March, we have International Women's Day, in which we have online campaigns and online webinars. And also in April, we will have awareness on food security and population dynamics, whereby we have online webinars and campaigns. In April, also we have a child immunization drive in commemoration of African Vaccination Week, whereby we have physical activities in various medical schools in Africa in cooperation with the MSA officers of SCOPA in various regions of Africa. Then in May, we'll have on International Day of Families, we have family planning and population growth awareness, whereby we have advocacy on contraceptives and birth control policies. We have also online webinars and online campaigns. On World Hunger Day, we will have online campaigns on malnutrition and child health, whereby for the aim of tackling malnutrition in children. Also in July, we'll have on World Population Day, we have online webinars and campaigns on policy advocacy on population dynamics. In August, we'll have on the breastfeeding week, we have awareness on maternal and infant nutrition, promoting exclusive breastfeeding to reduce infant mortality. Also in August, on African Traditional Medicine Day, we are planning to have physical events in various medical schools in Africa in cooperation with the MSI officers, SCOPA, various medical schools. In October, on World Food Day, we also have campaigns, online campaigns on sustainable food system and nutrition awareness. In September, on the World Contraception Day, we also have awareness campaigns on educating on modern contraceptive methods and safe sex practices. And then December, on the Universal Health Coverage Day, so have campaign and physical events to ensure quality healthcare access for mothers and children. Thank you so much. That is COPA.
Okay, thank you so much, Michael. I've seen a couple of raised hands, starting from James.
Okay. Martha, that has to be like a Zoom greet because I'm trying to remove them from the meeting and then throw
Okay.
them to the waiting rooms. Yeah.
Okay.
Okay.
Okay. So we'll have the next presenter, the FAMSA SCOMER chairperson, Wahida. You're welcome. In the meantime, while we're waiting for Wahida, you in order for us like to interact and get to know each other more, can you drop where you're from and your MSA within the chat box? Thank you.
If she's not in the call, can I call upon Ashley Kamal, the chairperson of ScopeUp?
Please make her co-host so that she can unmute.
Hello everyone. My name is Ashley Kamau. I'm from Kenya Methodist University in Kenya, and I'm currently serving as the chairperson of ScopeUp. ScopeUp mainly entails creation of content, publication of articles, as well as JAMS, which stands for the Journal of African Medical Students. I think we can start with the action plan. Kindly, please move to the next slide. Thank you. So we started with our publicity team onboarding in February, where we were able to do a practical session on graphics design and social media training. We focused mainly on the publicity officers, but the webinar was open to any interested participants. In February, also, we did the navigating the grant funding landscape, where we were able to go through the process of grant creation, understand that it's a time where the US funding has been stopped, though we look forward to future opportunities for grants. In March, we are going to do a call for articles for the April newsletter, which will be published on April 1st. On April, we will publish our April newsletter. Yes. Please move to the next slide. In May, we have our design thinking workshop, where we will carry out an expert discussion. We look forward to inviting Dr. Abdul Hamid to come join us and train us on design thinking. In July, we'll also do a call for articles for the August newsletter. And in August 1st, we will publish the August newsletter. In September, we'll do the annual journey to publishing in partnership with JAMS, where we'll take students through the process from ideation to publication of a research paper. Please move to the next slide. In October, we have our MSA expedition, where together with our MSAs in ScopeUp, sorry, We'll showcase various universities and their special artifacts, that is their infrastructure and details and talents that they will showcase. That is mainly to increase publicity and awareness of FAMSA and its outreach in universities. In November, we'll have our final call for the articles for the November newsletter, and it will be published on November 1st. Please move to the next slide. Thank you, and that's my presentation.
Thank you so much, Ashley. I would now like to welcome Miss Dorothy Osahon, but sadly she could not make it, so she'll be represented by Ikechukwu Augustine. Welcome.
Okay, good afternoon, everybody. Can I be heard? Hello,
Yes,
can I be heard?
Yes, you're audible.
All right. Thank you very much. My name is Amaza Ikechukwu Augustine, and I'm here representing Dorothy Osahon, the chairperson of the Standing Committee on Health and Education, who is currently unavoidably absent for reasons that I believe have been communicated to the FAMSA Secretary General. Okay, so I'll be speaking on our behalf. So the table on our screen is the list of activities that we plan to achieve, or the goals that we plan to achieve for the year. And then the first on that list, which will not only be done in January, is the commemoration of important health days and organization of capacity building sessions. And then our goal or the drive behind this is to have a continuous project of the Standing Committee on Health and Education that would commemorate to one health day each month. I believe we all know that for every month there is always this one health day celebration. So the aim is to create and publish a flyer and make infographics that will contain what the day is all about, useful statistics and capacity building sessions for medical students. Like I said, this program is going to be running all through the year. And then in February, we'll have World Malaria Day. Okay, before I move down to February, because I've already mentioned that we'll also be having capacity building sessions for medical students, which should also be running throughout the year. Currently in the month of March, from 8th of March to April 12th of this year, we're going to be having a capacity building masterclass focusing on critical thinking and advocacy, project management, policy making, collaborative leadership, and negotiation skills. So people are going to be learning all these that I've mentioned. So in February, we're going to be marking the World Malaria Day, and then it's going to be a physical partnership project to commemorate World Malaria Day on April 25th. Okay, the focus of this is that we have started making plans, or we have plans already, and now we are making moves to meet people that will be collaborating with us so that we can celebrate the World Malaria Day on April 25th. Okay, we also have the Eco Ambassador Fellowship will be held in March, in the month of March, a partnership project to train medical students on climate action and antimicrobial resistance and policy making. Okay, also in the month of April, the Standing Committee on Health and Education will be celebrating the World School Environmental Day. This will be we'll be having a physical partnership project to enable the Standing Committee on Health and Education local organizing officers to organize webinars, awareness work, cleanup drives, and tree planting. This is to raise awareness about the importance of environmental hygiene in our health. Please, next slide. Thank you very much. All right, so in the month of June, we'll be having our breastfeeding week, and this is going to be a physical partnership project to provide maternity items and advocacy works on the importance of breastfeeding. So basically, we are sensitizing breastfeeding mothers or pregnant mothers, or pregnant women rather, on the importance of breastfeeding. Okay, so in the month of August, we are going to be celebrating the Global Hand Washing Day, and this is going to be a partnership project. We are going to be partnering with soap companies. Yes, we are going to be partnering with soap companies to organize a challenge on social media. So this particular Global Hand Washing Day, we are going to be focusing on the internet and on our social media platforms. We are going to be carrying out projects on hand hygiene, and we're also going to be visiting secondary schools and primary schools to enlighten them about the importance of hand hygiene. And then in the month of September, we are going to be working on non-communicable diseases, and then the focus of this is to enlighten people on the ways in which they can live a healthy life, such that non-communicable diseases such as cardiovascular diseases, diabetes, and cancers can be prevented or managed. So in the month of October, we are going to be having our PINK project. This is to commemorate the breast cancer awareness month. It's more like a breast cancer awareness month. So we're going to be having a physical partnership project to commemorate breast cancer awareness month. Next slide, please. Thank you very much. So in the month of November, if you notice, the Global Hand Washing Day it also appears here. Okay, so which I have previously talked about. Remember, I said that some of our programs are going to be running for throughout the year, for some months throughout the year, and then majorly in November, we're going to be having a capacity building session and a SCOE in-house party. Okay, and then I've earlier mentioned that in the month of March to the month of April 12, 2025, that we are currently going to be organizing a capacity building masterclass. And I've mentioned or listed the things that those that are to be present are expected to be learning or expected to learn when they come around. And yes, for the participants, it's majorly medical students. However, non-medical students are also invited across Africa. So thank you very much. These are the list of plans or the goals that I wish to achieve this year. Thank you.
Thank you so much, Ikechukwu, for your presentation. I would like to welcome now the West African Regional Coordinator, Dennis Bly. You're welcome.
Thank you very much. Thank you so much. It's a pleasure to be here today to discuss how we intend to positively shift the activities of FAMSA. So at the level of the West Africa Regional Council, we intend to focus like the 3-year strategic plan talked about capacity building, strengthening FAMSA within the different MSAs, and increasing the visibility of FAMSA. So basically, the things that we have here will be centered around that thing and having the regional conference. So we've already started with meetings with different NMO presidents to ensure that we recruit more MSAs for FAMSA in the West Africa region. So if you're on this call, maybe you're an executive in your MSA, we're currently asking that you check up with your executive, including the president, to ensure that your MSA has a FAMSA officer currently representing you at the West African committee. Thank you very much. So moving in February, we're supposed to have our Google Workspace webinar that has been shifted to the second week in March for some technical reason. So the essence of it is we're still recruiting MSA officers, and the essence of this Workspace webinar is to train our MSA officers as the FAMSA officers and our council members on the different Google Workspace tools as you see here. So like the docs, the sheet, the drive, the meet, because these are tools that we're going to use throughout the entire tenure. So we want to ensure that people are well versed or at least have the basics so that when documents are shared, they can move along. Depending on the MSAs that are present, we might take 1 or 2 representatives from other MSAs also to join the training. It's going to be a 2 to 3 day training. And then particularly West Africa or having regional or coordinators or regional councils to is simply foster the goals and aims of FAMSA at the different MSAs in the region. So we're going to have what we term as FAMSA 101 sessions. That is where we teach you about FAMSA, the basics, basic orientation, what FAMSA is, when it was founded. Like one common thing you will always hear us say when we're pronouncing the entire name, we end with associations. You know, those basic things that you remember, and you know that the name of the association is Federation of African Medical Students Associations. You know, so we're going to be telling you the basics. So this is going to be organized by the different medical students association. We might incorporate collaborations. 2 or 3 MSAs might collaborate depending on the proximity. You know, some of them might be online. And then we also have a mandate as a regional council to have the regional conference. And it is the biggest event that the council, you know, organize in a year. So as early as March, we want to conclude with the MSAs that will be hosting the regional conference. Last year, it was in Togo. So if you're here, your MSA is interested, you can start doing your groundwork, because we'll soon be opening call for application to know who will host the next regional conference. Next slide, please. Okay. And then we are going to have our FAMSA 102 sessions that are supposed to be in May. So 102 is like a deeper understanding of the. I think. Don't you think you skipped one? Aisha, can
Yes.
you go back one? Can you go back one step? I think we're
Okay.
okay. Anyways, quiet. Just move forward, please. All right. So we're going to have our FAMSA 102 sessions that will be organized in May. This is going to be like a follow-up to the FAMSA 101. After you've gotten basic orientation, you start getting deeper understanding into the different positions, the roles and responsibilities, the different councils, standing committees, how they're operating and everything. You start getting better understanding and a holistic view of what FAMSA is. So this is also going to be organized by the different MSAs as well, same with the 101 session. And then in the last tenure, we had the Business and Healthcare Entrepreneurship Summit. So we're going to continue that particular summit. It will be hosted again this year, and it's going to be to teach us medical students and even some non-medicals how to engage into healthcare entrepreneurship and how to engage business entrepreneurship generally. That's going to be hosted in July. Is there any other slides for us? We're supposed to. Aisha, is there another slide for West Africa region? Oh, yes, good. Okay. So we also, over the course of the tenure, we intend to have a competition amongst the different MSAs. This is going to be revealed during the course of the tenure, where MSA is going to compete for a particular prize. So we're going to link with our different partners and link ideas amongst the regional council, and then we will come up with that as the tenure unfolds. And in September, we're going to have our West Africa Regional Conference. But now we had agreed upon who is going to be hosting the conference, and that is mostly going to be an in-person event that will be hosted sometime in September. It might be shifted depending on the time of the General Assembly. And yes, there will be non-communicable disease section that's going to focus on diseases like cardiovascular and all of that. So we're going to work with the relevant standing committees to have this organized as well. Okay, so that's about what the West Africa Regional Council will do. That's about what the Regional Council will do. We look forward to working with the different MSAs. We encouraging you to send forth your FAMSA officers because the FAMSA officers that we have will help us in the implementation of these different projects. So thank you all very much.
Thank you so much for your presentation, Dennis. I would now like to give the floor to the East African Regional Committee Chairperson, East African Regional Coordinator, sorry, Odongo Shadrack. The floor is yours.
Good evening, everyone. Hope I'm audible. I'm Odong Shadrack, a final year medical student from Gu University, Uganda. I'm acting on behalf of a big team of East African Regional Council. So I'm acting as the regional coordinator East Africa, and we are a 26-man team. So the following is our program for this year. Next slide. So we began the program already. We had an induction conference, where we inducted a 26-man team in their different capacities. That was done in February. We also have a February program where we are supposed to have capacity building for different MSA presidents, which was pushed into March, which we shall do. March, we are going to host MSA presidents. We have formed a WhatsApp group for MSA presidents, and our target is to have every MSA president on that group. We are trying to reach every MSA in East Africa, in the 18 countries. We may fail anything, but we want to succeed in reaching every. That is our prime target, reach every MSA in our tenure in East Africa. That's priority number one, and we are embarking on it. Next in April, we are going to meet the MSA presidents and then put our program on table for them and also listen to them. Next slide. Okay, June. From March to June, we have a malnutrition campaign where we have got a partner who is going to help us push together a campaign against malnutrition. What are we going to do? We have 3 categories of competitions. We are going to start with Kenya and Uganda, where we are going to have clinical presentations. We are going to have the best clinical presenter at each MSA in a pediatric case. We're also going to have best health talk at each MSA, and we shall have gifts for such best presenters. Then you have a social media content of any campaign you get against malnutrition, and our partner is already in place. And we, from after March, after beginning with Kenya and Uganda, we shall spread the same competition and campaign of malnutrition to Tanzania, Southern Sudan, and Rwanda. And these things will be done per MSA, where we want to make sure that FAMSA is felt at each MSA and create an impact. Good enough, we already have a partner to do that with us. Then our regional conference was supposed to be done in March, but we have another event in Kenya. So we are thought of blending the regional conference with the Scope tour. We want to get around 150 delegates physical from East African region to meet at Pan University. And we really think we can have a regional conference, which is more pronounced in June. So we are going to meet physically in Kenya for this regional conference come June. Then we have a FAMSA East Africa magazine which we shall be launching still in June, and the editorial committee has already got its advert out. Then we also have webinars, interesting webinars to look for. The first webinar is going to be a webinar for career guidance. We are going to have a surgeon, a pediatrician, a gynecologist, and a physician coming together to guide medical students on how they can make career choices after they are undergraduate. The other webinar is going to be about life after school. We are going to have married couples, a doctor married to a doctor, or three married couples. They're going to tell us what is life after school for a medical student and a medical doctor. Then you're also going to have a webinar on financial independence and performances. Then also going to have a webinar on global health, where we are going to have experts analyze for us the impact of global health, especially that now we no longer have more funding. What is it that we are going to be affected as African medical students and African countries without external funding? Then we have a sickle cell campaign. We identified that East Africa, we have some of our friends who are living sickle cell, but they're medical students. So they came up with a campaign, and we are saying that we should prevent stigma against sickle cell and other inherited diseases. Come September, we shall have an online webinar where we shall meet and talk to people who have sickle cell, what they find, and how to manage these conditions better. Then we are going to also choose the next regional host for the regional conference in the same month of June. Thank you very much for listening to me.
Thank you so much, Mr. Shadrach. I would like to welcome the next presenter, who Nzana Tressa, but will be represented by Kafor Ramson. Welcome.
Okay, good afternoon. Please, can you get me?
Yes, you're audible.
Okay, thank you so much. I'm called Chapo Ramson, and I'm a medical student from FAMSA, Cameroon, and I'm going to be representing Zana Trezor for Regional Council Central Africa. And this is going to be our presentation I'm going to be sharing my presentation. That's a presentation for the year plan for this academic year 2024-2025. Okay, please first. Okay, thank you so much. Okay, our first plan of action, that's our first project and activity, is the capacity building webinar. And this webinar is organized a meeting to introduce the year plan that will be which is organized this February. And the participants, we open it to everybody to be part of this webinar. That medical students, nurses, everyone can be part of this webinar. That's the participants for this webinar, and that's the project of February that we are going to carry out. That's this March, and during our March session, we are going to have monthly medical educational series, and it's organized medical related webinars. Example, we have impacts of climate change, and this is open to medical professionals all around the world, all around Africa in particular. In our April session, we are going to have medical quiz games, and this is to actually challenge our different MSAs to see maybe this is actually to challenge that at different MSAs. And through this, it will not only be like a quiz game, but it will be more like an interaction, a connection where we get to build up maybe that different MSAs can combine together to work you can get to connect with different MSAs from different countries, different regions, and all. And this is open to all medical students which are part of which are part of their respective MSCs. And we're going to have an online training session during the period of May. The training session is to help students acquire some skills that you can have emergency medicine, first aid, we have basic nursing skills, we have surgical techniques, advocacy and policy writing, stress and sleep management, importance of leadership in health. And these online training sessions each will organize different webinars which can help in this online training session. And it's open to everyone, that medical students, you can have maybe nurses, you can have maybe medical professionals already. So to be part of that, the online training session. For the project or activity of June, we're going to have a research webinar. We're going to have a webinar on research, and it's the importance of research to healthcare, because we actually do need that. I'm going to actually talk more on research on what more can be done especially in an African concept, because we do know that a lot has not been done when it comes to research, especially in Africa. So I'm going to focus on that, and it's open to all medical students and medical professionals. We'll have during the month of July, we'll have professional exchanges and organize the exchange between the Central Africa and English-speaking countries. So Central Africa will be having the exchange between itself and other English-speaking countries in Africa. And this is open to medical professionals. During our month of September, we're going to have a webinar on non-communicable diseases, where we'll focus on diseases like cardiovascular disease, diabetes, cancer, discussing prevention and management. And we're also going to add some diseases that are peculiar to our African society. And this webinar is going to be open to all medical students and medical professionals. In the month of October, we're going to have a webinar on scholarship opportunities, the presentation of medicine-related opportunities abroad, and will be open to high school and medical students who wish to be part of these opportunities. But we're going to look more into the high school aspect to give them more opportunities to be able to give the students more opportunities so that they can be able to achieve maybe brighter dreams abroad. We're going to have, during the month of November, we're going to have a cultural exchange. And a cultural exchange, and that's organized meeting on cultural diversity. We'll focus on cultural diversity, mainly in Africa, the different cultural aspects. And the participants will be only FAMSA participants, that's those who have registered themselves into FAMSA. And lastly, we're going to have the grand meeting, the end of tenure meeting in December, to look at what has been carried out this year from our plan of action, what has not been done, and how we can see to better prepare for the upcoming year, and how to see how we can improve on what wasn't done the previous year. Thank you so much. Please, I don't know if I was audible enough, because I think that will be the end of my presentation.
Thank you so much, Jafar. Thank you so much for your presentation. I would like to welcome our next presenter, Ms. Zainab El Sharif, the North African Regional Coordinator. You're welcome.
Okay, hello everyone. I'm audible?
Yes, you are.
Okay, this is Zainab Osama, Regional Coordinator of Northern Africa from Sudan. Good afternoon, everyone. It is a pleasure to be here today to present the 2024 work plan for the FAMSA North Africa Regional Council. This year, we have planned several important activities to promote public health awareness, research, and leadership development across Northern Africa. Okay, in March, there will be a leadership campaign, a research methodology training, and mental health campaign. Firstly, I'm excited to announce that our leadership campaign will begin this evening with highly skilled trainers. This program is designed to help students develop both soft skills and technical skills that are essential for leadership. We are looking forward to having all of you with us in this journey. Also, in March, we will conduct research methodology training where participants will learn how to design studies, create research questions, collect data, and analyze results. This training will be useful for anyone interested in academic and clinical research. Okay. Next, in this March, there will be mental health campaign. It's an important topic, and through our mental health matter campaign, we aim to raise awareness, reduce stigma, and provide practical strategies for management stress and anxiety and work-life balance. In April, we will focus on climate change and health, explaining how climate change contributes to respiratory disease, head stroke, and others disease. We also discuss sustainable practice to reduce this health risk. In May, there will be maternal health awareness. We will
I did online meeting, and I've been running. I've got present. I've been coming up on non system. Now I go along myself without using the present.
Okay. In May, we will focus on maternal health challenge, educating women, families, and communities about the risk during pregnancy and the importance of prenatal care and postpartum health, regular checkups, proper nutrition, and care the well-being of both mothers and children. In June, there will be breast cancer awareness under title Early Detection Save Lives. Our breast cancer awareness campaign will educate women about self-examination, mammograms, and risk factors. We also provide support resources for individuals affected by breast cancer. In July, we will be there FGM awareness. We will address the issue of female genital mutation, FGM, explaining the physical and psychological harm caused by this practice. We will also discuss legal action and cultural solution to help and stop the FGM in our community. In August, we will be there HIV awareness and prevention. We will focus on HIV education, explaining how HIV is transmitted, how to prevent it, and why regular testing is important. We also work to reduce the stigma around HIV and AIDS. In September, there will be non-communicable disease and diabetes awareness. We will raise awareness about non-communicable disease such as heart disease, cancer, and diabetes. We will focus on prevention management and health lifestyle choices. We will also have a special campaign on diabetes awareness, discussing causes, symptoms, and management strategies, including the importance of healthy diet, regular monitoring, and proper medication use. In November, there will be a hypertension awareness. With high blood pressure becoming more common, we will educate the public about its risk, causes, and prevention methods. We will encourage healthy habits and regular medical checkups. Finally, in December, we will be malnutrition and childhood obesity. We will focus in these topics, helping parents and communities understanding the importance of balanced diet, portion control, and regular physical activities to keep children healthy. At the end, this year, we have planned many important and impactful programs, and we are excited to work together to improve healthcare awareness in North Africa, and we will encourage all medical students to actively participate in these activities, contribute to research, and engage in discussion that will shape the future of healthcare. Thank you, all of you, for your time, and we look forward to working with all of you this year. Thank you. Hello, Aisha.
Okay, thank you very much for a wonderful presentation, and it's very interesting the plans you have for North Africa, this region. So since I can't hear Martha, I think maybe she's facing some technical challenges. I would chip in. So the next presenter would be the regional coordinator for the next presenter would be Bule Dube, the Southern Africa regional coordinator, represented by Yasmin Haitham Ali, the vice regional coordinator for internal affairs. Please, Yasmin, you have the floor. Thank you. Yasmin Al Ali, you have the floor. I've allowed you to unmute.
I think Secretariat, there is a compromise to the chat box. We need to move a few people there who are spamming the chat box with the. Okay.
Pardon, Bon, sorry, I did not get you.
Yeah, I was saying like the chat box, there's accounts that are blocked in and they are compromised. I think they were spamming the chat box. So I was saying like we need to remove all those who are spamming the chats and then before we can continue. Thank you.
I've already removed them.
Okay, thank you.
Thank you.
Yeah, thank you. Yasmin? Yasmin has been chatting me up that she's been having challenges, but I believe now it's sorted, right? Yasmin, I see you're now unmuted.
Yes.
Okay, thank you. You can
Thank
please, you're very welcome, and you can go ahead. Thank you.
Thank you. Hello, everyone. I hope you're all doing good. My name is Yasmin Al Ali. I'm a sixth-year medical student at the University of Eduardo Mondlane in Mozambique. There, I'm the vice president of the Medical Student Association at the same university, and I also play the role as the vice regional coordinator for internal affairs of the Southern Africa region. I'll be representing Bahul Dub, who is the Southern Africa regional coordinator, who unfortunately couldn't make it to this session. As a recap, the FAMSA Southern Africa Regional Council is made up of medical students in 8 different countries of the southern region. We have Namibia, Zambia, Zimbabwe, South Africa, Malawi, Botswana, Lesotho, Swaziland, and my dearest country, Mozambique. I'll be now presenting our year work plan. Thank you. Our first activity is going to be in March, where we will launch a mental health support program that includes a peer support group and stress management workshop. In April, we will conduct a workshop on research methodologies that focuses on practical skills and will also allow us to conduct and publish research. In May, we intend to partner with local organizations to host a health fair. This health fair will offer free screenings for different diseases, vaccinations, and health education. In June, we intend to organize a conference for the impact of climate change on health and also invite some expertise and stakeholders. In August, okay, in July, we have 2 different activities. The first one is the Leadership Development Program. This one is going to offer a program to develop leadership skills among medical students and also include some mentorship opportunities. And the second activity that we will have is an exchange program. This one will facilitate exchange programs with different medical students from different regions of Africa. And like that, we can share some knowledge and different experiences from each different place. In August, we will start with the nutrition and wellness campaign that is going to promote healthy eating habits and physical activities, and the regional symposium in some different and relevant health topic, such as digital innovations and global health challenges. In September, we have 2 different activities. The first one is to strengthen collaborations with the NGOs and government health departments for joint initiatives, and a non-communicable diseases workshop or webinar where we will approach different diseases such as cardiovascular diseases, diabetes, and cancer. And the main focus or approach is for the prevention and management. As our last activity, we have the annual review meeting that intends to review our achievements, our activities, and the assess impact. This is our year work plan for 2025, and we count on each and every one of you as a FAMSA member to help it be a success. Thank you very much.
Thank you so much, Yasmin, for your presentation. I would like to now give the floor to the next speaker. Next slide, please. So I would like to welcome our French translator, Pierrette Elikem. The floor is yours.
Martha, I think Pierre is not on the call and she's not represented. So maybe if we can go to the next presenter.
Okay. It seems that Pierrette is not in the call, so I'd like to welcome our Vice President, Mr. Bonaventure Machuka. Welcome.
Okay, thank you. Am I audible? Yeah. My name is
Yes,
Bonaventure
very much
Machuka.
audible.
Yeah, as you've seen from the introduction, I'm kind of like the overview or the police of the Executive Council. Yeah, and basically that is it, like monitoring and evaluating the Executive Council and of course coordinating the technical working groups, which is a crucial part of FAMSA that is responsible for the emerging global health issues. And of course, to oversee the organization of the General Assembly. Okay, so let's move to the next part. Okay. So yeah, this is as our work plan as of today. So this is something that can change, but it will change to better adjustments, not a deduction. So currently we are doing preparations for the 9th GA that initially was supposed to happen in Tanzania, but now will happen in Kenya. Come late in November, later in November, late in the year. And then training and orientation of the technical working groups has already happened that we did in February, a call for all technical working groups. We have a total of 8 working groups in the FAMSA, and those are responsible for the technical working groups for HIV and AIDS, technical working groups for climate change and planetary health, technical working groups for One Health, digital health and innovation. We have NTDs and communicable diseases. We have technical working groups for health systems and financing, and technical working groups for non-communicable diseases. So these technical working groups are quite diversity represented across the continent. And once we did the course, we had to look at the motivation and the capability of all members who had applied, and they are currently learning, and they are having their technical teams also inside them. And then, yeah, it offers a platform for different FAMSA members or more students from the continent to engage in this global health and emerging health issues in the continent. So in February and March, currently we are engaging with DNDi, that's what I'm coordinating, and also the WHO Kenya, WHO Geneva, and WHO Central Africa Republic. Those representatives and the Director General from Geneva, it's a continuation of the engagement we had from last year's WHO Regional Committee for Africa to support and develop capacity for Africa-led youth initiatives and associations, and FAMSA is the leading, and IFMSA Africa. So those are the engagements we are doing currently. Also registering FAMSA as Gavi, CSO, that is the Gavi Civil Society Organization constituency, where I'm the representative of the medical students, of course, in the Gavi CSO. Also with DNDi, I think with the recent shifts from the executive order of the United States, I think they had like a major implication also on the DNDi. This is the Drugs for Neglected Tropical Disease Initiative that is in 27 countries in Europe, Pan-American, and also in the African region, I think parts of Asia too, where we are supposed to engage and also strengthen our technical working group on NTDs, and also engage across Africa, since we know NTDs are a major public health threat in the continent. Yeah, so we are going to finalize most of these engagements with our partners by March. so that also we can continue having and engaging, since they are like the leaders in the global health, financing global health engagement. I think it would be important that we engage them. Secretariat, please, I want you to go through the chart and look at a name called hacker, and then you can do something. Yeah. Also, MSA Reach, we've heard from the different regional conferences, regional coordinators about engaging MSAs. Yeah, that is something we are trying to do as of now, trying to map and ensure FAMSA visibility as of our 3-year strategic plan. So it's the same method we are going to use to reach out to different MSA presidents and see how we can better have the numbers in our continent. Okay, next. Yeah, of course, follow up on GA hosting. This is something we'll continue doing continuously. The MSA that we'll host will be Moi University Medical Students Association. And the most important thing about this GA follow-ups, of course, is the resources and the finances, and of course, the capabilities and the potential attendance of the GA, who are the stakeholders who will be attending. We have our different partners, and that will be done in May. Come June, of course, there's follow-up on progress of projects in different technical working groups and standing committees. Yeah, that is the work of the policeman, of course, and you can see the participants there. It's important that we continue following up so that we can see like our action plan in different subcommittees, different technical working groups are being followed. Capacity building session. This is important, of course, to enhance this session 1, also session 2 and 3, to enhance the advocacy, leadership, fundraising skills through grants, of course, management and governance of these office holders, to strengthen the output, or to increase their output throughout the tenure. Also, there's a proposed virtual conference in healthcare leadership. That is a pre-GA, of course. Topics that will be engaging, of course, is the Agenda 2030, in students' involvement in research, capacity building in healthcare, financing, advocacy through publications, and public health leadership workshops and training. That is in August. Next part, please. Yeah, so this is approaching the GA. Of course, in August, we have the 75th WHO Regional Committee for Africa that will be happening in Lusaka, Zambia in late dates of August. And we shall involve, of course, the EC, the participants, the Policy Advisory Council members, and the FAMSA members will represent FAMSA in that WHO Regional Committee, and we hope it will be blended to facilitate more attendance and also convenience attendance. A focus on NCDs. This will be led by the technical working groups and also the standing committees. This is important as we focus the priorities in our continent, because we know it's a growing threat across the years. And then also enhancing capacity building sessions 2 and 3. That is 3, I think it's 3 now in this part of the year. And then that is in October, and we look forward to having, of course, GA preparations at this time, confirmatories, any plans, those arrivals, hosting, accommodation, all those nitty-gritties of the GA will be addressed then. And then next part. So this is towards the conclusion of our tenure, and where we'll have the highest decision-making and policy-making body of our, that is FAMSA, that is the GA. Then that's where we'll conclude our tenure as we hand over to the next tenure of 2025-2026. Thank you so much, Secretariat. Thank you, everyone who is in attendance.
Okay, thank you very much, our Vice President, Bonaventure. That was an amazing presentation. Thank you. So move forward to the next, which is the FAMSA President himself, Muhammad Isa Jafar. Muhammad, you have the floor. Thank you.
All right, thank you so very much, Aisha. Please, can you confirm if I'm audible?
Yes, loud and clear.
All right, thank you so very much. So, thank you everyone for joining us until this time. I know it's been a lengthy session, and yeah, our attention span doesn't is no more that very long. Anyways, so as the head of the executive council, of course, all that has been presented by the executive council members and officials of FAMSA are things that we're all going to put hands together to see them being implemented. It's not like it's going to be a fragmented effort, and it's not like it's going to be so parallel. Everything that aligns, we're going to put our efforts together to see that we maximize resources in implementing that. So the reason why every standing committee and every officer present his is because of the diverse interest of medical students, right? So there are medical students that are only interested in medical education and research. So anything that comes from other standing committees, they wouldn't want to pay attention to it. So that's why you see every official is presenting what he has, and you are going to see that there are some certain initiatives or programs that are basically similar. So when it comes to the implementation, we're going to see how we're going to put them together and synergize. So we're going to have sort of in-house partnership of the. So having that said, let me quickly take you through what I have in store for African medical students. Aisha, please, can we go to the next slide? Okay, great. So as the as it was mentioned in the introduction that I gave earlier on, that the Policy Advisory Council last year tried to develop a 3-year strategic plan that is going to kind of direct or direct or help the association know where to put its resources and how to identify key areas that needs more attention and more resources. So it developed the 3-year strategic plan so that we can be able to address our impacts and success as we go through time. So the first thing that comes to mind as the president is to try to see how we can implement that. It's not just about having the policy, it's about its implementation. So this does not just it's not just about the strategic plan. It also applies same to the internal working regulations that were developed last year. So in an effort to try to see that we've strengthened the association's administrative efforts. So that's basically what we've started, and so I'm going something that's going to continue throughout the tenure. And then on capacity building, you can remember that we had intention earlier. I made mention in the introduction part that this year we have we have the intention of being heavy on capacity building because of the current trends that we are seeing in the region. In terms of healthcare, the public health, funding is becoming an issue. All of those. So these are new challenges that are coming up, and they need, we need to build our capacity on those. We need to understand them. We need to have the adequate means. We need to have the skills and tools to be able to address them effectively. So this is why we are coming up with so many capacity building initiatives. You can see from the other officials of FAMSA, they've all mentioned them. So in this regard, we are implementing a Prof. Balaudi Capacity Building Academy that is going to be a year-long training program that is going to build the capacity of medical students that are volunteering within FAMSA and those that have interest in the association. So what do I mean by this? Okay, so basically after the election of the executive council, each standing committee, each regional council would need central committee members. So these central committee members, together with their local officers, these are the liaison officers to each member of FAMSA, that's the Medical Student Association, for example, for themselves in my own case. So these are the individuals that we want to build their capacity in areas, first of all, about FAMSA, so that people get to understand FAMSA at a deeper level, not just on the superficial, not that they know this, the association, this is what it does, this and that. So we're trying to see how we can have more FAMSA members understand this association, deeply understand its programs, and understand what it stands to, to achieve in long term, understand the documents, the policies within the association. So after that, also try to build the capacity of African medical students on project management and system thinking, because we believe, as mentioned earlier, FAMSA is a project-oriented medical association, right? So we have projects that are coming up from every angle of Africa, and we sort of organize everything on a continental level, but then the implementation, we go to the local environment, to those people who need it to implement it. So we need more members of FAMSA to be conversant. And please, can we remove these two people? Yeah, to be more conversant on project management and system thinking, also about leadership, policy and advocacy, and other very important areas. And then, as it has been repeated by my colleagues, MSA and NMO engagement, this is an effort that is similar to this. And then also, we would start the preparation of FAMSA's presence at WHO meeting early this time around. Earlier in the previous years, we do prepare for WHO meetings, like a month prior to the meeting, where we host workshop on policy and statement making and all of those important topics that we need to learn to be able to represent FAMSA effectively at this region. But then sometimes, it's not so very effective, in the sense that we don't have adequate time to go through the nitty-gritty details of these important topics and skills. So this is why we are intending to start it early, and that would give us the opportunity to build capacity in terms of policy advocacy and statement making, representation at high level meeting, because this is the only time that we try to do that for African medical students. So it should be something that we take our time to do it, and then taking our time to do it would give us the opportunity to partner with more organizations in building the capacity and in representing African medical students at this high level meeting. So yeah, that's for the FAMSA WHO policy workshop. Okay, because malaria is something that is so crucial in our region. It's something that is taking a lot of life. So we are giving it so much importance that we're intending to commemorate it in a way that is going to be very impactful. We are intending to see how we can maybe have an international malaria conference where we're going to bring stakeholders to discuss about this issue and the way forward. Because the earlier we engage, the next healthcare workforce in these discussions, the best. And then now, with the coming of the novel malaria vaccine, it's very important to have its discussion, to have it being discussed among African medical students, because they are the ones that are going to be doctors of tomorrow. Have it discussed very much in details with them, so that they get to understand it and become advocates of it. Because it takes time before these topics get into our medical curriculum. So we have to kind of complement it through this kind of initiative. So have a conference, and then have some programs being implemented, like outreaches and distributions of preventative materials like insecticide treated nets. So next, in May, we are going to be having a town hall meeting where we are going to engage with MSA members to kind of brief them on the workings of FAMSA, what we've been doing, and how they can, what are the challenges that we have experienced, and the way forward. Just a strategy of engaging our members meaningfully. And then in June, we're trying to see how we can strengthen our engagement with African Union. The African Union has Agenda 2063, a set of goals that are intended to Africa intends to reach by 2063. So we are trying to see how we can collaborate with the African Union to see how we can bring down this whole idea of Agenda 2063 to the level of African medical student, and then African medical student begin to first of all get to know about it and get to see how we as the African youth can key and contribute in this agenda. Then in around July, we are intending to host the first of its kind somehow, Africa Youth Health Summit, which is an international event that tries to feature African youth-led health organizations that would come to see if we can be able to identify the key pressing public health challenges of Africa, and then try to see how we can develop a strategy that we believe we can adopt, as African youth organizations to be able to solve these challenges. In a nutshell, African youth health organizations do carry out very impactful, very meaningful programs and projects addressing series of challenges that have been faced by the region. However, some of these efforts are fragmented, and you hardly can be able to bring them together and weigh the impact of it. But then we believe if we bring these youth organizations together, we would be able to identify challenges together and put out a solution together that maybe periodically we can be coming back to trace progress, and then see the possibility of creating a consortium of African youth health organizations so that we can all adopt that strategy that is developed and see how it will continue to that advocacy, that document strategy would be advocated all across Africa, and see its potential being achieved. So that's for the summits from me. Okay, so the next engagement we would be doing is the actual participation of FAMSA at the WHO Africa region. This is more like one of our major advocacy platform where we share our thoughts and advocate for what we believe in. And then next in September, we'll be having MSA Leaders Convention, try to get all MSA leaders on board and discuss on series of issues, what the specific needs of MSAs and countries and regions, so that going forward in the future of the leadership of FAMSA, we can see how we can prioritize those areas. And then in October, we'll also be commemorating Breast Cancer Awareness Month together with the related standing committees and technical working groups. This is mentioned here to give emphasis on the need for this for awareness on breast cancer, because it's the idea of breast cancer is known, but then still, if you look at the cases of breast cancer in our hospitals, you understand there's need for more action to be taken on that regard. So and then considering our nature in Africa, we are a low-income community, and then the treatments for breast cancer is something that is hardly affordable by majority of Africans. Yeah, so this is why we have to put emphasis on prevention. Yeah, so that's what a lot of Africans can be able to do. So it's in raising awareness that people will understand the early symptoms and what they need to do when they see these early symptoms. So we intend to commemorate it through conference and also local programs and outreaches. So the next program we're going to be doing is in November is commemoration of World Antimicrobial Resistance Awareness Week. Antimicrobial resistance is something that is very serious globally, and it's even more serious and something that needs more attention in our region, in Africa. So we'll try to see how we can collaborate with the relevant stakeholders to actually raise awareness in this regard. And then after commemoration of World Antimicrobial Awareness Week in November, in the same month, we'll also be engaging as COP30. because we believe Africans have to have a lot to contribute in the discussion of climate change. So this is why this year we are incorporating it into our plan to actually do something around it by sharing what we believe on, at least sharing what we believe on climate change and related topics during that time. And then oh, okay, this is a repetition. Can we go to the next slide? Okay, so yes, this is what we have for you, African medical students, and we look forward to having you all engage meaningfully in FAMSA this tenure. Thank you.
Okay, thank you very much, Muhammad, for the wonderful presentation. There are a lot of really interesting plans we look forward to. So, the representative of the French translator is with us. So I would like the person to please unmute. And take their presentation. Yves, representative of the French translator, have permitted you to unmute.
Okay, thank you very much. Sorry for the mix-up. So, Ms. Pierrette is currently unavailable, and I'll be representing her for the French translation team. My name is Prévert Adeshina. I'm from the Association des étudiants en médecine, pharmacie et odontostomatologie du Togo. So that's in Togo, of course, as in the name. For the French translation team, the agenda for this year will be starting in the month of March, where we will be having a translation workshop. These sessions will be on medical scientific terminology and spatial jargon, and that will be between the language translation team to further improve their comprehension of other languages that they will be translating. In the month of May, there will be a French session that will be designed to help Executive Council members, as well as the general Francophone and Anglophone FAMSA members, to communicate among themselves. As we all know, effective communication is key to having a good conversation. So it is important that we ensure that language differences does not hinder interactions between members of FAMSA. In the month of June, the translation team, in collaboration with the Regional Council Central Africa, will assist in the FAMSA Discovery webinars. These webinars will have the goal of introducing the Federation to Francophone regions that are not well acquainted with FAMSA. And they will highlight the benefits of joining FAMSA and also provide detailed information on how to do so. During the month of July, we will have a professional exchange scheme in collaboration with the Regional Council Central Africa. These sessions will be aiming at exchanging with medical students, especially from West and Central Africa. In the month of August, the translation team will focus on the translation of documents produced by the Executive Council, ensuring that every project reaches the non-English speaking audience. We also working with past Executive Council translators to draft a comprehensive rule description for translators. The goal is a document that by the end of this tenure will be incorporated into the toolkit to better clarify of translations, translate September
Is it only from my end or his network is fluctuating?
No, I think it's his network.
Okay, let's give him a few seconds and see. I believe he's not the only person that is yet to give his presentation. There is a standing committee to be missed when Martha was moderating. So please, if the representative is ready, should indicate in the chat box. Okay. Well, I guess
Try and mute him again. I think he was kicked out and he's back.
let me try unmuting him again. Prevail, please, are you able to unmute?
Oh,
I think he's still having connection issues. So we have our ex officio too present with us here, Mr. Victor Femi Lawal, and please let's recognize him. Let me see if our French translator would be able to come back one last time. If not, we'll move forward to the last item on the agenda and round off. Well, I guess would be rounding off from here. The document would be available for anyone interested in going through it. So it would be shared, and I believe every item is self-explanatory. So I would like to call on Mr. Victor Femi Lawal, our ex officio too, and the immediate past FAMSA Vice President to please unmute and bless us with a closing remark. Thank you.
Hello, everyone. Good evening. It's such a pleasure to join this meeting. Can you all hear me?
Yes.
All right, thank you.
Yeah,
Yes,
hear you
good
loud and clear.
everyone. Thank you. So good everyone. Such a pleasure to join this meeting. I think I've just been trying to follow a bit with the presentation. I think they've been wonderful. I'm seeing the wonderful plans from the various standing committees, various regional councils trying to really engage as many medical students from Africa as possible. And I think that's a theme I've seen recurring, trying to engage and of course trying to increase the impact of what we are doing. So I'm really, really impressed by that. I think I saw Mr. Jaffar's presentation about the African Youth Forum. And these are really wonderful initiatives. Also a way of trying to engage with more MSCs, more countries. These are really wonderful plans. I really hope the EC this year is able to actually carry out this. And I think I saw this year that the French Office of the French Translator had quite a robust strategy for the year, and I think that's not something we've not really had in a while. Typically, the French translator is just kind of works with other things, but it seems I'm very glad to see that trying to have more francophone speaking more francophone members. Hopefully we'll be able to expand to other Arabic, Portuguese, and so many other countries, and medical students are not included. So I think, to be honest, I think this has been a very, very wonderful set of presentations. And I encourage all Afro medics or medical students to work with these these webinars, these sessions, these initiatives. They are wonderful. They are ways to build a capacity. They are ways for you to engage and really elevate as far as being a medical student and even beyond. So I really encourage you, enjoy you to work with the EC and to carry out these plans and of course elevate yourself as medical students in Africa. So thank you very much, everyone. Of course, I wish the EC the best. Of course, we'll be there to definitely support. But of course, I definitely wish every member of the EC the best and success in actuating these plans. So other than that, thank you very, very much and having a great stay, everyone. Yeah. So over to you, moderator.
Okay, thank you very much, Mr. Victor, our ex officio. That was a really warm closing remark. And next we have is pictures. So we'll be taking pictures. Can you all bless us with your beautiful faces and open your cameras? So let me give few seconds for that.
Aisha, I think you should stop presenting so that we can. Okay, I think you are not presenting.
I
So
think I
yeah,
stopped thinking, right?
I see. Yeah, you did. Thank you.
Okay, so we'll be taking a picture after the count of okay, I'm going to count down from 3. 3, 2, 1, cheese. Okay. Please, someone should also be snapping. I shouldn't be the only person snapping, just in case someone is a better cameraman than me. So once more, 3, 2, 1. Okay. Now, thank you very much, everyone. I think this brings us to the end of this amazing session, the FAMSA 2025 work plan presentation. It's a pleasure having you and being amongst you. Thank you very much for joining us and have a nice day. Bye. Can the host please end the meeting?